So government, together with the business community, stepped in to create most major vaccination sites so that communities could have centres close to them to get their shots. To get a sense of how this collaboration has fared so far, we're joined by Dr. Ronald Whelan, head of Discovery's COVID-19 task team, as well as Coovadia from Business Unity South Africa. A very good afternoon to both of you, gentlemen, and thank you very much for joining us. Mr. Coovadia, let me start with you, perhaps, and let's talk about the integrated strategy to vaccinate the insured and uninsured across South Africa. This collaboration between business and government, has it borne fruit?
Yes, I think it has borne fruit. Business at the time, in fact, not just for the vaccines, but at the time COVID hit our shores, business pulled together a broad business platform under Business for South Africa. And we've been working with government and other social partners for the last 2 years, essentially over 2 years, in the first period to help manage the pandemic across a broad sphere of activities. And in the second phase to support government in the rollout of the vaccines. And business has, over that period, I think when we were managing the pandemic, we had about 350 people working on a pro bono basis across various disciplines, supporting government in this. And in the vaccine rollout, we probably had about 40 people working pro bono in supporting government in rolling out the vaccine. And there's been glitches along the way, there's been problems along the way, but by and large, I think the collaboration between government and business together with inputs by other social partners has actually shown that if we focus on something and we put ideologies and other issues aside, we can actually put our resources together to make a difference. And yes, it has actually been successful.
Dr. Whelan, we'll talk about the documentary that your organization has produced to actually track this progress. But I think just going a step back, why was it important for your organization to collaborate with government?
Well, I think firstly, it's always been a Discovery ethos to work closely with our business partners and indeed to work closely with governments. Always look for opportunities for public-private partnerships in improving access to services for the broader population in South Africa, and indeed making
Dr. Whelan,
usual configuration.
Unfortunately, we are losing you there intermittently. If you could please just start from the top for us and why it was important for you to get involved.
My apologies for that. Internet seems a little bit unstable today. Yes, as I said, Discovery is always sought to enter into public partnerships. We've also always looked to work with our private sector partners. We think that's important for two reasons. I think the first one is that we recognize that patients make South Africa globally competitive. And as you've seen in the vaccine program, we're really in a global race for vaccines, and we needed to punch above our weights to get access to vaccinations. And in fact, we wouldn't have had access to the Pfizer vaccines had it not been for the intrinsic capability across South Africa's pharmaceutical supply chain. You remember that. Fortunately, we've got that supply chain in South Africa's private pharmaceutical sector. I think the second reason it's important, and we've seen the power of this in the vaccine program, in a public-private collaboration allows us to provide access to services to all South Africans. So I think one of the highlights for us certainly at Discovery and for SA has been able to open up vaccination sites to everyone, insured people and people without insurance. And that has really, I think, improved the experience and improved the uptake of a vaccine. So we're very proud of this effort, and the documentary really speaks about the public-private collaboration and indeed our partnership with the private sector businesses across South Africa.
In the absence of having something to show our viewers, perhaps you could talk us through the documentary and what it actually showcases.
Well, I think it showcases three main elements to the vaccine program. I think the first thing it speaks about is the procurement of vaccines. As I said, it was a very tough environment procuring vaccines globally. You'll remember that there was significant demand for vaccines, with many developed countries procuring many more vaccines that they would need than what they would need for their population. So that's the first thing the documentary highlights. I think the second thing the documentary highlights is the coming together of private sector partners, government with private sector partners, to set up vaccination sites across the country. Discovery obviously lent in as much as we could in setting up 9 vaccination sites. There was a sprint to get those sites up and running. We all worked together across a period of 2 to 3 months to prepare these vaccination sites and the vaccine supply chain on that. So we take you on a behind-the-scenes journey around setting up the infrastructure for vaccination sites in South Africa. And then the third part of the documentary speaks about South Africa's leading on the Omicron outbreak. You'll remember that the Omicron outbreak led to South Africa's 4th wave. We were the first country globally to have a significant outbreak. And indeed, South Africa, in collaboration with our actuaries and data analysts at Discovery, led the first insights on vaccine effectiveness against Omicron. So we give you a sneak peek behind the scenes around how that came to the fore. And that was certainly a very proud moment for South Africa, being able to demonstrate the effectiveness of the vaccines against Omicron, lead some of the thinking globally around that. And we're very proud of that partnership with the South African Medical Research Council, the National Institute for Communicable Diseases, and indeed the National Department of Health.
Mr. Coovadia, in the absence of a vaccine mandate, the country does not have a policy on that. So business have been given the discretion to apply at will what they will do about vaccine mandates, at least for their organizations. There have been a lot of voices that have criticized business for the way they have gone about this in terms of forcing people to get vaccinated. So while it is great that we are ramping up efforts to get people to get vaccinated, there are those who choose not to. What has been your assessment of business and vaccine policies?
Well, firstly, business has been applying some sort of mandatory vaccination policy according to directives under the Occupational Health and Safety Act. And they've been following those directives. So they haven't been doing it willy-nilly. They haven't been doing it in an ad hoc way. Secondly, businesses have the responsibility to provide a safe workplace to all its employees. And business has utilized those directives to put into place policies and mechanisms to essentially work with unions and others, and within the context of labor legislation, to say that they have, if a business takes the decision that they want all their staff to be vaccinated, that is their prerogative to do so. If a staff member chooses not to be vaccinated, businesses have said that that staff member has to produce a negative certificate after having tested, and do that regularly. And businesses aren't saying that they don't legally have the right to force anybody to take a vaccine, but they do have the right to ensure that the workplaces are safe, to ensure that if somebody chooses not to vaccinate, they are testing positive, and where somebody is testing negative, and where somebody is positive, and the business can ensure, or somebody doesn't want to vaccinate, and the business can ensure that that person is social distance from other staff, they will do so. But if a business is such that they cannot do that, then they have to go through proper procedures to enable staff to let staff go, if that is the case. Retrenchments are the last resort, but businesses are doing this to protect their workplace and then protect staff that have been vaccinated. The sort of ancillary reason for this is that we do need to get as many people vaccinated as possible, as quickly as possible. But all the science shows that our biggest tool, our most effective tool against this pandemic is vaccination. And businesses are, through their policies trying to get as many people vaccinated as possible.
Business Unity South Africa CEO Cas Coovadia and Head of Discovery's COVID-19 Task Team, Dr. Ronald Whelan. Thank you very much, gentlemen, for joining us this afternoon.